Sure. Thanks, Gary. Maybe we could just go just a little bit further into next week. How much of Kirk's staff will be allowed back in, that first week, and then maybe any general precautionary measures or standard procedures once the student athletes start coming in, whether it's June 8th with football or in another facility June 15th with men's and women's basketball.
Yeah, so the approach, the pilot project that was approved by the critical incident management team on campus, we send them the lists of people. It's actually not necessarily every name, but it's how many staff members are essential to have football fully operating under this volunteer environment. It's strength coaches, it's athletic trainers, it's the full-time coaches, and a few other support people. And then, we'll do the same in the other sports. There are a few people like myself, a couple of other administrators who will be in that process so that we can be on campus, especially during this limited time with specific purpose. So now to the limitations. As I mentioned, there will be a door that you walk in the Hanson Performance or in Carver Hawkeye Arena. And there will be somebody screening everybody that comes in. One, making sure they're on the approved list, and then two, going through a screening process. And the medical staff is still finalizing it, but it will be things like you've heard, maybe a temperature scan, maybe a question of, how you're feeling today, if you had any other symptoms, and basically just going through a daily screen and making sure before you come into the building that you've gone through that process. And then there will be protocol in terms of if you're in the hallways or the public spaces, what do you have to do? Do you have to wear a mask? That's very likely. You're not going to wear a mask as you're actually working out. That's one of the unique differences of a student athlete versus most of us in social distancing. And so from a training perspective, when you have your mask off, and that's one of the reasons testing is going to be important. So those are, and then once you're done with your workout, leaving the building through the dedicated exit, having the number of student athletes that can train at one time, that'll be limited. So there's a long list of things, and again, we're going to learn from that list. These are voluntary workouts. When we move to the next step of required workouts, we'll have learned some things, and we'll be even more prepared and more efficient when we get to that point. And that'll be the same for the staff entering the building or the student athletes.
All right, I'm just kind of going to pick and choose a little bit here on follow-ups. Guys, let me know if you have a particular question. Mike Kloss, do you want to kick us off? Any follow-up for Gary?
Steve, I just got, this is the virtual kick under the table. Matt Henderson just kicked me under the table virtually and indicated that my data was not 100% accurate. 48,000 is the number of season ticket holders from last year. And we're at about 75, a little bit more than 75%, maybe 76% renewal of those 48,000. So please, if you can fix my mistake from earlier, I guess that's one of the downsides of trying to do this virtually. Thanks, Matt.
All right, thank you. Mike, do you have a question?
Does Mike know how to do Zoom? Does he know how to unmute himself?
There you go. I'm not sure. Mike, can you hear us?
All right, one moment.
You're good now.
Hear that?
Yep.
All right. Tailgating. I mean, this is obviously a vital thing for all these people that buy your tickets. Do you have any idea how you're going to be handling this fall? Is it too soon to go on record about that?
The honest answer is I don't know yet. I expect there will be some modifications, but we've been so focused on getting the student athletes back in this volunteer mode. We have talked about it. We have begun to identify parking lots, and again, if it's 100% versus 75% versus 50%, whatever the percentage is, We do expect that not everyone will come to the game. We also have to, transportation is a broader topic. We also have to talk about the train and whether or not we'll be able to put the Hawkeye Express back into production. If we do, we may have to limit the number of people that we put on the train. So we know that's a question that will be addressed. By the way, we have a team of people. Marcus Wilson leads that team up for us, has in the past, and before him, it was Paula Jantz. But we've already begun regular meetings with people on campus to deal with game day. And like the other categories, we're preparing for different scenarios. But Mike, to your specific question, we have not yet put a final touch on how tailgating will be. I agree with you. I know how important tailgating is. I joke with a lot of the fans as I go through the parking lot, they invite me to join them for their favorite beverage or their favorite food of choice. And I always remind them, I haven't tailgated at a football game since I don't even remember the last time. And I look forward to it someday. I know how important it is to our experience. I can comfortably say there will be tailgating. I'm not ready to say exactly how that's going to work. That was a long answer, Mike. Sorry.
Yeah, what? Kidding.
Chad Lystico, did you any follow up to your questions?
Sure. Hey, Gary, thanks for doing this. Just a little two-parter here. Do you know how many athletes will be allowed? Do you have a number for how many athletes will be allowed into football facility, and how will that look in terms of are there coaches in that room at all, or do they have to be virtual? Can you kind of paint the picture of what will be permitted? And then kind of as a attachment to that, have you heard concerns from football players or families about returning, and how have you addressed those?
So a few different questions inside of that. The first is, I don't know the exact number, and it may be that our doctors are still developing the exact number, if it's going to be square footage or if it's going to be a hard number. I do know there will be limitations on how many student athletes train at one given time in a particular space. And so, as we develop those, Chad, if it ever becomes a hard number or a number per square footage, I can share that with you all later. As it pertains to who can be in the room, it's voluntary workouts. As part of that, strength coaches and athletic trainers can be in the room, and for safety reasons and to monitor the safety. The regular sport coaches cannot be a part of voluntary workouts under normal circumstances, and can't be a part of voluntary workouts under these circumstances. So no different from that standpoint. Who can be involved is the same as it has been in the past. And then your final question, I'm trying to remember what the third question was.
Just concerns you've received maybe from families around the country about returning.
So the first part of that answer is no, I have not received any direct concerns. I'm not aware. Coach Ferentz and I have talked about it. I don't think Kirk has received any direct concerns. Remember, this phase is voluntary. So if someone did have concerns at this point, they wouldn't even have to raise them with us. We have had conversations about what happens if a student athlete or a staff member, doesn't feel comfortable coming back to work. And understand, there could be an underlying health reason that they're not able to come back and train or work, or it could just be a concern that isn't able to be addressed. Because remember, as long as the virus is here, and until a vaccine is created, there will be risks. And we cannot eliminate, no matter what we do, we cannot eliminate the risk. We will work to mitigate it, and then people will have to make that choice. If we have a student athlete who chooses not to return, they will still remain in good standing with their team. We will work to mitigate the concerns that they raise, but we would not have a student athlete during this year if they felt they couldn't compete or train because of this COVID-19 virus. They would not lose their status or their scholarship.
Josh Christensen, do you have a question?
So Gary, you were talking about risk. So I guess my question is with this virus and with opening things back up again, are you looking at, and you're saying that, you know, this is a way to kind of figure things out in the next coming months. So is there, so I guess, what are you looking at? And let's say, you know, God forbid, you know, an athlete does get sick. Is that going to be a point where you do shut things down again, or do you keep things going, or how's that all going to, what would be in that scenario, I guess?
Well, I think everybody in the country, whether it's from a business perspective, whether it's from, you know, again, going to a restaurant, certainly opening the campus, and now drilling down into athletics, it's not a matter of if someone gets the virus, it's a matter of when. And the answer is if, and please, I'll present this in a way, and when it comes out, I hope it comes out the right way. If one person were to get sick and we were to shut down, we might as well not open up. And let me just explain myself. We expect that there will be students on this campus, there will be staff on this campus who will get the virus. We will have medical plans on the treatment of those students or those faculty or those staff, just like the community has. And we will manage it with contact tracing, making sure that you know, we're aware of where that person was, and then going through a protocol to return. But that's the way it's going to be approached. Not if, but when someone gets the virus, student or staff, having a plan in place. Our hospital, you know, one death is too many. Our hospital, I believe at last count, in Johnson County at UIHC there's been 7 deaths. Those 7 are 7 too many, but there hasn't been a death. Again, I haven't heard today's updates. There hasn't been a death in over a month, or in about a month. So I think the treatment that we're able to provide in our community, we're so fortunate, and the outbreak has not reached a point where our hospital, great, you know, we have thousands of employees who are coming to work every day, and they're doing a great job. So again, I hope that came out right, because your question's a fair one. My answer is we won't shut down the minute someone gets sick, but because we anticipate people will get sick, and then it's just a matter of managing it.
Tom Caker, do you have a question?
Hey, Gary. I'm wondering about, you know, as the guys come back, you guys were feeding those guys too. You had those buffet meals and things like that in the football complex. How are you going to handle, you know, the food distribution, I guess, moving forward?
Yeah, I didn't mention that in my protocol. I didn't cover everything in protocol, but nutrition and food is part of the protocol, and just managing it. You know, we also have something called the Black Card, which is a card that allows student athletes to go to participating venues in town. So that's one possibility, as well as other protective ways. The days of the buffet for now are probably limited or gone, at least for now, and serving food or providing nutrition through other means is definitely part of the plan.
Adam Rittenberg, you have a question?
Hey, Gary. I just wondered, you know, you're talking with the Big Ten, your colleagues around the Big Ten daily. What's your confidence level that they have in terms of their ability to execute a similar plan and ultimately have a season? Or is there any concern on your part that not all members would be ready for the season from your understanding in those conversations?
Well, to my, Adam, I don't know if you were on board when we started, but to my first comments, if anybody in the Big Ten or anywhere else is telling you they know, they're either spinning positive or they're guessing. And I would just tell you that the mood is, I can't speak for every AD, but I can tell you, being with them virtually every day, they share the same ups and downs that I do every day. One day I think like it's a no-brainer, we're going to do it. The other day, the next day, I'm concerned because I heard something new. I think everybody is preparing similar to what I've described. They're preparing for football being a full season. They're preparing for football with fans, and they're preparing for football with as many fans as want to come, and then scaling it back from there. So I think there's a good confidence level on May, whatever day it is, May 28th, with 100 days left until the first kickoff. Ask me that in another 50 days when we're 50 days out, and we'll see if we still have the same answer. Adam, it's a fair question. I think everybody is preparing with the confidence that they'll be ready. One of your side questions was, do we anticipate that there could be some universities in the Big Ten that could play and some that couldn't? We certainly, that's again one of those areas we're prepared for. If we have to go that route, we don't have all the details lined out, but we've talked about it. And so again, preparing for many different unknowns and being ready to change on a dime if we have to each day that goes by.
And just regarding a timeline, I don't know if it is 50 days from now or if you've discussed with Kevin or just among yourselves when there almost has to be, okay, we're in or we're not sure. Is there a point where you guys individually will have to make those decisions?
There absolutely will be. And there has not yet been a date where we've said by this day, we have to decide. And so I can't tell you the day. There will be a day, Adam, when we have to make a decision. That day is not yet, and I don't know exactly when that day will be. But because we talk every day, I think it won't be difficult between the 14 ADs, the commissioner, and the infectious disease group, and then communicating with our coaches. The communication, I've never been so in contact with our commissioner, our conference, and the other ADs as we go through this. So I guess we'll know when we need to make that decision.
Scott Docterman.
Hey, Gary, thanks so much for doing this. My question has to deal with the stadium. If you have to reduce capacity for the first month, similar to what even Jamie Pollard just announced, how will you alter seating within the stadium? Will you require a seat in between people or groups, or will it just be certain parts of the stadium off? Have you gotten that far in any kind of discussion?
We've had the discussion because we're going to wait until we get, if we get some absolute, in our state, here's what it would have to be. The CDC saying here's what it would have to be. We've come up with, you've heard the 6 feet, you've heard masks. We have suites and club areas. Are those different than the general seating area? So yes, Scott, we're having all those conversations. We have, I don't know how many ideas we've looked at. We've looked at several ideas, but we're not ready to say which ones we're looking at until we have some reason to focus on a number. If that number is 75%, 80%, 100%, or 50%, we'll adjust. We'll make that decision. And as I said earlier, we'll decide who gets in. If we have more people wanting in, then whatever entity limits us letting in, we'll have our priorities point system kick in. And the other thing is, you want to be careful that you don't become too prescriptive too early and then have to change it and recommunicate it or have to alter it because it changes after you announce it. So I know your question's fair. I know you'd love to, know exactly how we're going to do it. If we knew exactly how we were going to do it, I'd probably share that with you, but we don't have an absolute plan yet. We'll come up with a plan once we know how many people we either are going to have or we can let in.